We're treating a serious problem related to hormonal changes with a very simple treatment, very few needles, and with just 3 sessions we were able to make a major difference in this patient's life. This was a case of erectile dysfunction caused by low testosterone plus anxiety. This was a relatively young patient, but in most cases like this, what a patient would do is just go to his regular doctor and ask for hormone replacement therapy. But this patient he suffered his whole life from a heart condition that was controlled, but that created some risk factors that made it unadvisable for him to do hormone replacement therapy. As you can imagine, this was taking a huge toll on his life. The patient suffered from a lot of anxiety from his work, and this was conditioning his sex life, plus the low testosterone. He couldn't maintain an erection. He has a young wife, so it was very hard for them to manage this problem. And so he came to me to see if we could help with acupuncture. So come with me and let's dive into the case. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses, I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases. So if you want to learn about it, check them out. This was a 37-year-old male patient. And as I said, he was suffering from anxiety, low testosterone, but his main complaint was erectile dysfunction. He had been dealing with erectile dysfunction for the last year. That's why he went and done the blood work to see that he had low testosterone, but his doctor wouldn't advise him to do hormone replacement therapy because of the heart problems. So he'd been dealing with erectile dysfunction for the last year, and it was getting worse and worse as time went by. And so I examined the patient, and I could see that there was a lot of anxiety, a lot of wood signals in the patient. You could see that there were a lot of liver-related symptoms in the patient. So we could see a trembling tongue, and his pulse was, in general, very wiry. It was a strong pulse, but very wiry, which made me think about treating the liver. Plus, if you work with a balanced method, when we're setting up a global balance to treat male hormone problems, usually there's a recommended pattern that works for most cases. Of course, this is not a protocol. You always need to do your diagnosis, but in most cases, you will reach a global balance that goes with large intestine, pericard, stomach, and liver. So a balance between Jueyin and Yangming. This is amazing to treat male hormones. For female hormones, not as much. If you want me to make a video specifically on how to approach male hormones versus female hormones, let me know in the comments and I'll make this video for you. But for now, let's focus on this. So this was already in my mind, but being that the patient already had a history of a heart condition, he had some other problems, I decided, along with the classical Chinese diagnosis, to add Master Tung's palm diagnosis to search for something called the root cause. Within Master Tung, we use the palm to diagnose the root Shenjing for the problem. This is usually something that's closer to, even though not exactly the same, but it's closer to a constitutional diagnosis. So sometimes the Shenjing you'll find might not even be related to the patient's symptoms, but it might be an underlying cause that is creating problems. And that's the reason why sometimes you treat according to symptoms and to a more superficial diagnosis, but then the problems keep coming back or new problems keep coming up because you don't treat the root cause. And when I analyzed the patient's palm, I saw that he had issues with his heart Shenjing. So I knew that I had to work also with the Master Tung points that had the Shenjing or the reaction area of the heart. And this made total sense because the patient had suffered all his life from heart problems. And if you remember, when I talk about the Shenjing, I always tell you They're not the same as the meridians or the classic channels, and one of the differences is that the shunjing always relates to the actual organ. So the shunjing of the heart will treat problems related to the heart. So I wanted to use points with the shunjing of the heart, and in particular I wanted to use the best set of points from Master Tung to treat the heart, and I decided to use the set of points 88.01 plus 02 plus 03. This is the best Dhamma in Master Tung to treat when you have a root cause related to the heart shunjing. If you want me to do a deeper dive on how to use palm diagnosis, how to diagnose the root cause, and the Dhammas that work for each root cause, again, let me know in the comments and I'll make a specific video on it. But for now, I selected these 3 points and placing them on the same side of the stomach because they're in the middle of the thigh, as you can see here. So I consider them as being part of yang channels, even though they are outside of the classical channels. And these points obviously have the shunjing of the heart. But along with this, we had to add more to the treatment. As I said, I wanted to do this global balance, and there was still another set of Master Tung points that was very important to treat his problem. So I went back to his arms. For the large intestine, I decided to use 22.05 or Lingu. Lingu is an amazing point to treat gynecology, to treat male issues. It's very close to large intestine 4, so it's in the hand, an image that can represent the genitalia. Also has the shunjing of the heart plus kidney and lung. And along with this point, I also added another unnumbered Master Tung point, which is Sun Yang. This is a set of 3 points in the hand, and this is the #1 point in Master Tung to treat male issues. So erectile dysfunction, prostate, problems with the testicles, the penis, we always go to these Sun Yang points. So I added these points to treatment. And I went to the other side where I wanted to use the pericard. And I decided to use pericard 6. This is a very strong point, everybody knows, but I wanted this particular point because the patient complained about anxiety, and he said when he was more anxious, he felt like his chest was getting tighter. And we know that pericard 6 is an amazing point to treat tightness in the chest. Then I went back to the legs, and along with the points 88 that I've already added on his left leg, I decided to use also the point 66.05. If you remember, this point is very close to stomach 43, as you can see here in the image, and it has the shunjing of the uterus plus the stomach. If you see shunjing of the uterus, you might think this is a gynecology-related point, which is true. But in my opinion, most gynecology-related points will also work for male issues. So, whenever I'm treating erectile dysfunction, prostate issues, testicular issues, I always tend to use points that have specific indications for gynecology, because in Master Tung, we don't have a lot of points for male problems, but we have a lot of very strong gynecology-related problems, and 66.05 fit perfectly within the balance that I wanted to make because it was in the stomach channel, so I added this point. And then, to finish, on the right leg, I used 66.03. This point sits between liver 3 and liver 2. It has the shunjing of the liver plus the heart. So, again, it fit perfectly with the diagnosis that I've made of this patient. It sits on the image and it balances the liver channel, which I wanted to do both for the hormonal part and for the anxiety part. Along with this, I added only 2 more points, which were Yin Tung, which is amazing for anxiety, and Dumai 20, which I also love for anxiety. This was the treatment for the patient. After the first treatment, the patient told me that he felt different, but that the differences were still mild. So he was still dealing with erectile dysfunction, he was still feeling anxiety, but not as much, and he didn't feel so much pressure in the chest. So we kept the exact same treatment. After 3 sessions of the same treatment, the patient reported that he felt a big difference in his erectile dysfunction, The patient reported that he was feeling major differences regarding the anxiety. He felt calmer. He didn't feel any pressure in the chest. Even in situations in his work where he should have more anxiety, he felt that he was more controlled. But the bigger difference that he felt was related to his erectile dysfunction. He still had some issues, but it was a lot better. He was now able to have satisfactory sexual relations with his wife. He didn't feel the same kind of problems that he was feeling. Again, it was not completely resolved, but it was almost not a problem anymore. The treatment here is still ongoing. We still have a bit more to improve regarding the erectile dysfunction, and I'm waiting for the patient to do another set of blood work so we can evaluate if the testosterone is back to normal or if we need to tweak something in the protocol. But as you can see, with a very simple treatment, very few needles, and with just 3 sessions, we were able to make a major difference in this patient's life for something that he'd been dealing with for a year and that was creating major problems in his life. Also, for the people that might think that acupuncture is just used to treat pain, is just used to treat anxiety, as you can see here, we're treating a serious problem related to hormonal changes. And even without having the numbers for the testosterone yet, just from seeing the difference in the patient's symptoms, we can see that we are making a real difference in his health. And that's why I encourage everyone to learn Master Tung acupuncture, because this is one of the most powerful acupuncture techniques that exists, in my opinion. And as you can see, we can really make an impact in our patients' lives. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it. And I'll see you in the next one.